transparency and justification report when they increase the price of a drug above a certain threshold, or when the drug costs more than the median household income in the U.S. Today's hearing demonstrates exactly why we need more transparency. While big drug companies have taken in record profits, more than 1/4 of Americans struggle to pay for their prescription medications. These same Americans are the taxpayers who are footing the bill for research and drug development that companies like Moderna are benefiting from. Researchers have estimated that prior to the pandemic, the federal government and taxpayers invested more than $337 million in mRNA vaccine technology and development. Mr. Bancel, I didn't read your mention of those numbers in your written testimony. I believe that when drug manufacturers significantly increase the price of their drugs, that they should have to provide information to the public that justifies these increases, including research and development expenditures derived from federal funds. My bill, the Fair Drug Pricing Act, also requires that companies provide information on all stock-based performance metrics used to determine executive compensation associated with price increases or high initial launch prices. Mr. Bancel, your stock compensation is, I understand, based on performance metrics set by your board. And last year, it's reported that you earned salary and stock compensation worth nearly $400 million. This is despite the fact that your board apparently found that you actually underperformed the company's target for sales income generated by the COVID-19 vaccine. So I want to ask, the decision to increase the price of the vaccine is, it appears tied to the impact of your personal performance assessment on your bonus and how much you would stand to gain personally from increasing the price of the COVID vaccine. Can you talk about how much of that decision to increase the price is related, as I just suggested?
Thank you, Senator, for the question. It is not related. When we look at price, we look at value. For any product, we look at what's the value of a product to the healthcare system, how much money can be saved. And that's how the price is being determined. And that's why, as I mentioned initially, if you look at the cost of a flu vaccine at CVS, it's around $95 for a high-dose flu vaccine used for the elderly. And given there's 2 to 3 times more hospitalization of COVID versus flu, that was one of the metrics we looked at as looking at price. The other one, as you might be aware, the cost of a pneumonia vaccine is around $230. So that's kind of how we looked at price.
Well, let me ask another question. Moderna's most recent annual report stated that the company repurchased $3.3 billion worth of stock in 2022 and over $800 million in 2021 to, quote, return capital to shareholders. Mr. Bancel, you are one of, if not the largest shareholder in Moderna. Yet despite spending significantly to buy back stock over the last 2 years, Moderna's share price has actually declined. If you had not spent nearly $5 billion on buybacks when your stock was at the highest price it's ever been, do you think you would be under less pressure to raise the price of the COVID vaccine now?
Thank you, Senator. So the price is not linked to the company's performance. The price is linked to the value of a product to the patient and to the impact on the patient. That's how we set price.
Thank you. I yield back.